Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we have Dr. Anna Cabeca, who is a triple boarded OBGYN, integrative medicine, and anti-aging and regenerative medicine doctor, also known as the girlfriend doctor. She has two best-selling books, The Hormone Fix, a groundbreaking holistic lifestyle program for menopausal women, and Keto Green 16, a comprehensive nutritional plan to staying healthy and slim at any age. We're thrilled to be chatting with her today
Yay.
about one of our favorite topics, vaginal moisture, and how it impacts the pelvic floor and hormones. So Dr. Anna has a great cream that we use in the clinic. Julva, is that how I say it?
Yes.
Yeah. Um, and so can you tell us kind of how you came to create this cream and why it's so different than other ones and what you need to be careful of as a patient when you are choosing a vaginal moisture?
Yeah, I became very interested in women's sexual health really in my youth, really, as I saw how there was such a huge discrepancy in general in women's health and men's health. And so as a OBGYN, I came to practice in St. Simons Island, Georgia as part of my National Health Service Corps scholarship. I hung a shingle, and one of my first patients to come in was the 63-year-old woman who was a president of a biotech company, and she had a history of ductal carcinoma in situ of the breast and was told she couldn't have any hormones. And honestly, so she's like, Dr. Anna, I'm a woman of the 60s. I haven't been able to have sex with my husband and it hurts. And I'd rather die than live this way. Help me. And I was like, oh, Lord, like that was like my first week in private practice. I'm like, wow. And she was kind of intimidating, tall, striking, silver fox, right? Very, high energy type A. And I'm like, shit, I better help this woman, right? I looked at my doctor's bag and I didn't have anything to give her. So I was a researcher before I went to med school. And I just started digging in through the research and the archives at NIH. And I looked at research on DHEA, on testosterone, and how that could affect breast tissue. I'm like, oh, can have a positive effect on breast tissue, not negative. And even vaginal estrogen was shown to be safe in women who have had a history of breast cancer. So I had options for her. And I started treating her with, bioidentical hormones, vaginally and topically on the vulva. And that just changed her life. And not only did she enjoy her sex life again, but she's like, her bones got stronger. She felt better. She's at 83. So that was at 63. And I've known her through 83 years old now. And she published a book. She wrote a book and published a book. I mean, totally with it, like on task, living life and thriving, not a victim of her diagnosis, right? And so that inspired me to look at, okay, what I could do for patients that was natural and effective. And then through my own story and my own journey, which I write about, for helping myself as well helping others with sexual health issues and vaginal dryness and bladder leaking. I mean, I delivered 4 big babies. I delivered 500, like 600 or 700 altogether, but 4 of my own, right? But, and that changed anatomy, and bladder leaking in my 30s, unacceptable. And I wanted to do what I could without surgery. And so that's how I started working, creating creams and using compounded suppositories, and then creating my own product, something natural without fillers, without, preservatives, without, endocrine disruptors to apply externally. Because I will say, if it's not bringing you pleasure, you don't need to put it in your vagina, right? So, so topical cream, clitoris to anus, it's so important. Every one of us will experience dryness unless we actively keep the pelvic floor strong through exercises and, and flexibility and nutrition and using, anti-aging regenerative cream like Jolva. So that's how I did it. And the ingredients were easy to choose because so much good research on it. And I played with it for already 15 years before, over 10 years before I created Julva.
Mhm. And can you talk
Dr.
to us about DHA that's in the Julva and why that's so important?
Yeah, so in Julva, I put DHEA, which is a prohormone, adrenal, like one of our adrenal hormones that are secreted by the adrenal glands, or prohormones secreted by the adrenal glands. And it has been shown to be very anti-aging, to help with bone, to help with memory, to help with connective tissue, to help with, supporting the pelvic floor with vaginal moisture. And this is a really big difference. We can get prescription estrogen, and that's what most people get. In fact, I received an email from a patient. I delivered her baby 15 years ago, and she said, Dr. Anna, I've had this vaginal dryness issue, and my doctor gave me, vaginal estrogen for twice a week, and I'm just really struggling. And the reason is estrogen works on the mucosa, just like on the inside of your mouth, right? The inside of the vagina. Estrogen works on the mucosal layer, but DHEA and testosterone work all the way down to, the connective tissue, the muscle layers. And so we can see an improvement in the folds and the appearance, like a reverse aging of the appearance of our pelvic floor, and including the glandular secretions. So it's not like a lubricant where it's just temporary. This is getting your body to produce its own natural secretions naturally. And that's what really makes a difference. So the DHEA is game changing. And we start losing DHEA in our late 20s, early 30s. So like boosting up a little bit DHEA in our system, it's a win-win all the way around. But topically, because you can't take enough orally to get the effect on the vagina, the same with estrogen. You can't take enough orally to get the great effect that you can on the vagina and vulva and the clitoris. Let's not forget the clitoris, because that will shrink away and hide as we get older if we let it. And we cannot let it, because that is pleasure zone central and really critical for orgasm in women. So I know we don't need to talk about that here, but it's so important. So, there's an expression called, I don't know if you've heard the clitoris called this, the little man in the boat. Have you heard that?
No.
But it's so true, right? Now you've got a picture, the little man in the boat. That's the clitoris. It's like, oh yeah, now I know where that is. So DHEA works topically because that will, that is so important. It will shrink as we get older, and we don't let that happen. And we do that with DHEA. And the other key ingredient that I combined in here was plant stem cells from the alpine rose. I wanted to use stem cell technology. I've been studying stem cells for years now. And what's beautiful about the alpine rose, it's this flower that blossoms amongst the harsh conditions of ice, rocky terrain, high altitude. I mean, it's tough, right? But it blossoms. And if that doesn't define femininity, I don't know what does, right? And in and of itself, the research showed that it has antiviral properties. It helps with fine lines and wrinkles, helps work on the connective tissue layers. And I'm like, okay. And I played with different concentrations and forms and added that in here, as well as other ingredients. So the oils and blends that are in here. And that's how I started with Julva. And you see the testimonials on our website from 70-year-olds having sex again to postpartum moms with bladder leaking, fixing that issue, and athletes, and name it. And I just think it's about time, right? Women take in their own hands the control of their body, right? To know it, to understand it, know what it feels like, know what it looks like, and to take care of it. And for me, this area, clitoris to anus, that's prime real estate. That's the most important real estate in our body, because will affect us more as we get older than problems with our pelvic floor, including the number one reason that caregivers put their loved ones in a nursing home is because of incontinence. So keeping the pelvic floor strong through exercise and topically well conditioned through using Julva, that will prevent, I mean, that really will help prevent these issues and reverse them if you have someone who's struggling. I always joked, and when I heard that incontinence was the number one issue that caregivers put their loved ones in nursing home, I'm like, man, I have 4 daughters. They're looking for excuses to tuck me away somewhere. So I'm not going to let them have that
Oh my
one.
goodness. Um, what is, what do you see the most with products? Like what are some products that people use that are like so horrible that you see a lot of people using?
Oh, absolutely. A lot of the lubricants that people are using and the washes that
Yeah.
people are using, like especially like the feminine washes are so drying, and that's going to add, I mean, it's just going to dry out your skin. You wouldn't put any of that on your face. If you won't use it on your face, don't put it down there. And
Right.
I think that's really important. And with Jolva, it's so funny because I've been using it on my lips for years. So now I'm coming out with a lip formula because those fine lines and wrinkles, like you don't need filler. I mean, seriously, but people are like, I'm not going to put it there and here. I'm like, okay, I'll come out with a separate formula. But it's so true, right? And so if you were not going to put it on your face, don't put it down there. And that makes a really big difference. And I think one of the things that I've seen a lot in looking at products and lubricants is like aspartame, something, I mean, so gross and so toxic. And it's like, okay, well, that's not good. Other endocrine disruptors, petroleums and parabens. And I mean, those are all going to affect the pelvic floor. What I love, and I know Kathy, you've got one right there too, like we'll hold up our pelvic floor models. I love it. Oh my gosh, right? This is so important. We need to know that there's a little man in the boat. There would be right there, little man in the boat. And so we look at, when we look at the pelvic floor is, there's so many muscles, so many tiny muscles. There's so many nerve endings, over 8,000 nerve endings in the clitoris alone. And the blood supply to this region is tremendous and intricate. And, as a pelvic floor surgeon, there's the anatomy here, and the blood supply is just so vast. And this makes this area, the pelvic floor, so good at absorbing what you put on it. So what you put on it has to be really clean. The chemicals, the washes, the soaps, between drying and chemical disruptors, starts to dry the delicate tissue of the vulva, the labia, the clitoris, and then you get the cigarette type of appearance, can be like can go as far as lichen sclerosis, or just the, vulvovaginal atrophy, the dryness, the thinning, the loss of the natural folds and elasticity, right? If we see it in our hands, around our eyes when we get older, right? It's happening here. So we want to keep this area strong. And so recognizing that what we put on the pelvic floor is going to be absorbed. So we want to keep that clean and, and well conditioned and well nourished, even using oils too, like, a good coconut oil and a good olive oil, and, naturally condition the pelvic floor in a keto green diet, right? Avoiding inflammatory foods. Age us everywhere. We'll see us aging between inflammatory foods and stress. I mean, look at every president, pre and post office, right? Pre and post term. I mean, that rapid aging from stress and inflammation. So we want to keep the pelvic floor as clean as possible, because this is so vascular. But this is also why we can use, something like Jolva and get really good results all around. So, all along the pelvic floor, and without inserting Jolva vaginally, the, great vaginal changes too, because of the vascularity of this pelvic floor. So
Yeah, I mean, that's great. We see so much of pelvic floor dysfunction, and a big component is the issue with vaginal moisture, people just not knowing or being educated on what they are applying to their vulvas. So many people clean with soap, which disrupts your pH and the whole vaginal flora. So it is so great. One of the first things that we do in the clinic is like take a mirror and we have our patients like look at that area from anus to clitoris, and really know what it looks like and what normal looks like, so that when they have a baby, then they know, okay, something's not right here. And like you said, it's really taking charge of your own body and that whole area, because so many women have no idea what's going on.
Absolutely.
Until
I
it's
couldn't
too
agree
late.
more. Until it's too late, right? Until like, but I would say here in this situation, because working with women even in their 80s, it's never too late. We can always do some. I mean, again, because the area is so vascular, we can always make progress. And this is another thing that many people don't realize, and this is why it's so important with the pelvic floor, is that there are hormone receptors in our fascia. Right. And if we look again at the pelvic floor, I mean, this is a sling of fascia. So as we get older, it gets stiffer, less elastic, and it hurts just like our knees, just like our joints if we're not taking care of them. Right. And so this fascia becomes stiff and more likely to break and yes,
Hard.
and just contract and hurt. Right. And so that affects everything from the function to the comfort level to sex, to intimacy. And so when we can give ingredients back to the pelvic floor through healthy fats and, and using something like Jolva, you see these changes just change right before your eye, the comfort level, the, even to the fact of getting up less or not even having to get up in the middle of the night to use the bathroom, just stronger, healthier, more functional.
Yeah, that's great.
Totally. You're like preaching to the choir,
I
Dr.
know,
Anna.
it's like I was that you guys are my favorite audience because you guys are dealing with this and you see how important this holistic approach is to reverse these problems so that we're not
Totally.
suffering, so we're not getting tucked away in nursing homes, so that we're not sleeping in separate bedrooms and being roommates and not lovers. And I loved it. One of my clients said, Dr. Anna, we went from being roommates essentially to boyfriend girlfriend again after 20 years of marriage. And I love hearing that. And it's really important. And in a very personal note, I'm dating now, finally in my 50s, and I've been divorced over 10 years. But, hearing over and over again is just like, how many people became roommates lived as roommates for 10 years or so of their lives. And the reasons for, I think okay, this time period, late 30s, early 40s, even to 50s, that transition time period when our body's changing, we have got that's when we get to get to the gym. We've got to get keto green. We've got to put nutrients on to support the function of our body as we go through transition. Menopause is mandatory. Suffering is optional. So
Just like you would get like a fancy cream for your face, you got to get a nice cream for your vulva.
exactly. So true. And again, I would, I just would say it's even more important down there. It's even more important down there. But then when my, Christian Dior red was bleeding, I had those lipstick bleeds. I'm like, oh, that goes back up here. Taking care of all my lips here.
Dr. Anna, do you have any recommendations or are you working on a lubricant for sex?
Well, I would use Jolva during sex as well.
You would.
Absolutely, because it's
Okay.
great for guys too.
Awesome.
Yep.
Great.
And the one thing you can add some additional coconut oil too, if you wanted, or fractionated coconut oil. And if
Okay.
you're having irritation too, I have a great do-it-yourself formula for adding lubricant. So definitely use Jolva. And again, it's fine if it gets inside during sex,
Great.
no worries. Great for him, no worries. And we have some guys using it too, because to help with erectile function and things like that. So, but they don't want to use a vulva formula, but those are strong. Those are men with good self-confidence, right? But so the do it yourself, I think this is one of the best ones that I've loved, and I know your audience will love it too. So a do it yourself lubricant you can use, especially when we're getting older or we have a postpartum, we want something really clean and natural. It's aloe vera gel, a clean aloe vera gel, and mix it half and half with fractionated coconut oil and blend that together. If you don't like coconut oil, the smell or whatever, you can use an almond oil. And so, shake that up and then And you can add a little bit of witch hazel if you're having, like, if you have hemorrhoids, if you have, fissures or really delicate, a little bit of witch hazel can help smooth out the cream. But the oil and the aloe vera gel, combine that, and now add your favorite essential oil, just a couple drops to it, shake it up, use that, prior to sex, squirt it into your hand in a little pump jar or squirt jar, and use that, in abundance with sex. That really helps. And it's such a nice, smooth, easy feel. And it's also, it's very healthy at the same time for your pelvic floor. It's not going to disturb the pH. It's not going to irritate. It's not going to cause dryness, right? And so, it's really beneficial that way. So, that way you're not using a whole
Love
tube of
that.
Jolva during sex, but
That's amazing.
and just even
Yeah, so
general
helpful.
coconut oil, like I always say, have a jar of coconut oil in the kitchen and one at the bedside. Don't cross pollinate the two. It's a really good lubricant too. Just something like that makes a difference. The aloe vera is really nice because of, again, the dryness in the tissue and often sometimes cracking, especially as you get older. That initially you'll want to use some aloe vera in there too.
Cool.
And Dr. Anna, could you say a little bit for our audience about vaginal pH and how that affects? I know like the three of us all know about that, but I would love for our audience to learn from you about how you explain vaginal pH and the function, like how it impacts the pelvic floor.
Yeah, absolutely. And that's something we check as gynecologists. If someone comes in with an infection, one of the ways we tell, okay, is it yeast or bacteria, is vaginal pH. So the more acidic, typically yeast, the more alkaline, bacterial vaginosis, bacterial overgrowth. What's really important to understand, as our body's changing as we get older, the vaginal pH, which is normally around 3 or 4, pretty acidic, right? Because it is our first line of defense to defend us from predators getting up into our cervix, and that includes sperm. That's why there's millions of sperm, and just one is effective. Like they need millions to pass our natural defenses of vaginal pH. That's why it's so important not to douche, not to mess, with these chemicals in the vagina, because even like certain tampons and sanitary pads and laundry detergents can affect the vaginal pH, and that's going to increase our susceptibility to infections, as we've seen over and over again. So the vaginal pH will naturally get more alkaline as we get older, but when we're keeping that tissue healthy, then we're going to keep the vaginal pH more on the acidic side, and that makes a really big difference. So we do that not just with like the healthy, avoiding chemicals and using Jolva, but also with, I call it keto green eating, like, breaking up with sugar, giving your body chance, like that intermittent fast, give your body a chance to digest and absorb the nutrients, and eat enough healthy fats. I mean, I was in high school and college in the 80s when the low fat movement was full on. And I was a student to, like I was a very research oriented student. I'm like, it was like taboo to eat fat because that would make us fat. I mean, I struggled with weight my entire life. And in my book, The Hormone Fix, I talk about when I was over 240 pounds at one point. So, I mean, this is, a really big issue. We need fat. We were brainwashed into thinking we don't need it. It's a reason we have hormonal problems. So we need healthy fats in our diet. And that's why getting keto green and, looking at our body's natural balance and restoring our, focusing on the things in life that make us more alkaline. So like, things that bring us pleasure, because stress is acidifying, cortisol acidifying. Oxytocin, the hormone of love and connection, is alkalinizing, very alkalinizing. So between what we eat and how we think and live and act and who we surround ourselves with makes a difference in our overall quality of life. I know we were talking about the vagina and I got off on this, but I'm so passionate about it because, from a healthy diet, we can improve the vaginal pH and everything that goes with it.
Amazing. We couldn't
It's
agree
so
more.
funny. Yeah. And it's so funny because as a gynecologist, I said, you can tell the health of the individual through, the health of their vagina. I mean, you really can. And so, and I think that's an important thing to realize. We're not a summation of parts, right? We're one whole being that needs to be looked at in its entirety. And the care, the model, that we implement to help our patients has to be that whole body approach.
Yeah,
Beautiful.
I love that. I think we end there because that is so key. That holistic approach and looking at the whole body is so important, especially when you're talking about hormones. And unfortunately, women's hormones are just like, there's not much known about them. No one really knows how to treat it. And
so much fear, right?
Right, unnecessarily. And now we're seeing the results from the Women's Health Initiative study come back and say, oh, no, it wasn't estrogen. I'm like, okay, we recognize it was the progestins that are still being prescribed to women. Right? The progestin, oh, we've got safer ones. I'm like, bioidentical progesterone is the safest one. So let's use that. And in our, as we learn about hormone balancing, et cetera, and we understand the differences in progestins versus progesterone, I mean, that makes a difference. My cream, balance cream that I created too, is one with progesterone and pregnenolone, as well as some tripeptides technology, again, because if you're going to use it on our skin, it's got to be anti-aging too. So, but has those hormone, those bioidentical hormones to balance too, because often, whether women have had a hysterectomy and aren't given progesterone, and they need it more than ever, right? It's probably a progesterone insufficiency and estrogen dominance that, is most often the reason that the hysterectomy was needed to begin with. So we have to correct it no matter what. And post-hysterectomy, patients have a lot of pelvic floor issues. And so, and it's really important to readdress and get those natural hormones back on board and balanced as quickly as possible.
cool.
Mm-hmm.
Well, thank you so much for joining us today.
Thank you.
Thank you for having me. My pleasure. And thanks for all you guys are doing for women.